Hi, Karen Damshan with Damshan Financial Planning, here with another health insurance update this week. We're going to hammer home on health insurance. So, as many of you saw, we had extreme sticker shock on health insurance plans this year. If you enrolled in an Affordable Care Act health insurance plan prior to December 15th, then you have a January 1st start date. And that's when your new policy will be in effect. If you were just so appalled by the cost of plans, and maybe you're making a decision to go a different direction or go without, let me just put a couple of thoughts in your noggin today as we think about the reasons for health insurance. Health insurance, like every other insurance, is truly there as a way to help protect you in the event that something happens. So if you were maybe on a silver plan or a gold plan last year, maybe you could go down to a bronze and get your premium down a little bit. You may save some in that monthly cost by changing your level of coverage. You could increase your deductible if you don't anticipate hitting it. Or your max out of pocket could go up if you don't really anticipate hitting it. So you can try and keep those costs a little bit lower next year. A lot of the news in Washington seems to have centered around this idea that HSA or health savings accounts are going to somehow magically change things for folks who are enrolled in individual coverage. And I just don't see that as the case. Now, there are lots of rules around HSA plans. Happy to discuss those with you in greater detail. But a couple of quick things to know that are changing for next year. One of the most important is if you are enrolled in any bronze plan next year, you have the ability to open and contribute to a health savings account. Now, why is that important? Well, because the rules around health savings accounts and the way you are allowed to contribute to them prior to 2026, you had to be enrolled in a qualified HSA plan. But for 2026, it doesn't have to be a qualified HSA plan, but it does have to be an individual plan on the marketplace. So if you are off the marketplace, if you are enrolled in employer coverage, those types of places to contribute to an HSA, you will still need to be enrolled in a qualified HSA plan. We have explored lots of options to the Qualified Affordable Care Act plans. We do have some of those short-term major medical plans I've talked about in the past. These are underwritten health insurance, so you have to answer health questions when you apply. In many instances, they are less expensive than the Affordable Care Act plans, and may be a good option, especially for those of you who are just saying, I'm going to go without. So while you can be denied based on pre-existing conditions, medications you may take, doctors you may have seen in the past couple of years, sometimes it's worth at least going through and trying to apply. These plans can charge you more based on things like how much you weigh, medications you may take. So they can have different levels of rating that they use. And most of these short-term plans won't cover pre-existing conditions for the first usually 12 months or so. My algorithm is filled with health insurance options. So I see a lot of these things come through, and I've been hit really hard over the weekend by some of these Medi-Share programs, right? My experience with these is through your experiences with these. And that has been that when the rubber hits the road, most of the time those plans don't pay the way they may have promised that they will pay. So that's just something to keep in the back of your head. Sometimes you have to add things like accident coverage separately and those types of things. So we're looking at all the options we can to try and get you covered in the event that something goes wrong to put a cap on those medical expenses. So as a financial advisor, I really view my duty to you as protecting your financial future. Those of you who take medications, please make sure you are exploring some of those medication services like GoodRx or Amazon's Pharmacy or Cost Plus, or there are about a half a dozen of these that are out there where you may be able to find your prescription medications at a lower cost, even than it was available through insurance. So those are just a few of the things we look at as Washington is still considering what they're doing with tax credits or not doing with tax credits. Remember, today open enrollment ends January 15th officially. So we do still have a few more weeks if we need to get in and make changes, enroll you in a plan, those kinds of things. Those short-term or major medical plans I talked about, those are not tied to the open enrollment period. We can look at those anytime. I hope you found this helpful. As always, I'm going to keep you updated as we watch things change. And I'll be back in your inbox again next week.